teenage girl named Haley, and she's like struggling, and her dad stopped being a truck driver, and she had to go to school.
Ethan, what's wrong with
She's like dealing with problems and stuff, and that's what we're reading. And her dad has PTSD. She used to be a mother.
Gotcha.
Mm-hmm.
Do you guys like the book?
Yes.
Yes.
Very
It
You guys should probably explain more.
It was very good.
So,
It was
like,
a waste of time.
her dad, when he tries
When did
to,
you
like,
finish the book?
he, like, fixes, like, he reacts to, like, all his things in PTSD.
He
that
drinks
faces
and-
with, like,
He drank.
anger, and, like, he turns to drugs and
He likes
alcohol.
weed and alcohol and
Yeah.
stuff. And she says it like
Hey,
smells.
And he like
And
destroys the house and just holes in the wall.
And he has, like, flashbacks when he does that. And she's basically taking care of him. So,
Wow.
it's really sad.
It is sad.
Their mom and grandma died, and his like her stepmom, that's the lady that he kind of remarried right away.
You should ask
And so
And now she's back, so it's bringing back old memories that,
kind of makes it
yeah,
worse.
it makes it, like, sort of worse and sort of
So that
better.
like it depends.
Yeah,
If I could.
it's just really,
I
really
answer
sad.
my question.
We're under the highlight one.
Not
order.
one. Only one.
Okay, well, everyone's supposed to have the book read by today, so
So
I'm gonna say it. At the end of the book, he tries to go suicide, and she talks it out of him. You were supposed to finish it.
Well, it's
Yeah.
not finished. I just wanted somebody to tell me.
It was a bad
You're
ending.
funny.
They should have died.
Yeah, so it's like really sad at the very end.
Gotcha.
he was gonna like jump off.
Does he die?
No,
No.
he should have died.
Wait,
They
does he
would've
try
made
to
it
jump?
better.
Does he try to jump off the quarry?
He's actually sitting
We got sick.
Haley's like standing on a snow drift that's over, and she falls through, and he
He
actually
caught her.
And he like dissipated his shoulder, and they both like broke ribs.
She
and
tore her
stuff.
ACL.
Wow.
And they all broke ribs.
She tore her ACL and she jumped off the fence or something like that.
Yeah. When
No,
she
that was
jumped
her
over
knee.
the fence.
That's
Yeah, that's in
where
your
your
knee.
ACL is.
It's the
I
tendon
thought your
that.
ACL was here.
No, it's the
No,
knee.
that's your knee.
he's sitting on his
I know that because my cousin did.
Okay, yeah. So, next
Anyway.
question.
Let me do my question.
Are you recording? Okay.
Okay. All right. Can you tell us about your profession? What do you do and who you work with?
Oh. I am a licensed clinical psychologist. Specifically, I'm a forensic psychologist, and I work with all kinds of things. I have a specialty in working with people who are trauma victims, and so, for example, it's not uncommon for me to treat children or teenagers who have either experienced a trauma themselves, had somebody in their family die traumatically, witnessed something traumatically, and so those are the kinds of things that I do on a regular basis. I also testify in court quite a bit, so if they're looking for expert testimony about something, if they have a question about psychology, about something that may have happened, they'll also ask me questions about that. So a lot of times I work with children and families.
Okay, so since you like work with kids,
Mm-hmm.
so would you work with like kids who have like, let's say parents in the army, like, and like not saying they died, but they're just like kind of going through this little trauma that their parents may not come home, or like, do you like have something to do with that?
I have seen that on occasion. It's not something that's very common here because there aren't active duty military bases really close to here. To my knowledge, there's just one, but I have been exposed to that because I'm a military brat myself, so I know exactly what it is you're asking.
Okay,
Yeah.
so Haley, the veteran's daughter, Andy, she suffers from watching her dad go through like what he faces with PTSD and how he suffers.
Mm-hmm.
And so like, how is the family of someone who has PTSD or experienced trauma affected? Like, is what? And is PTSD common in children? Is that even real? It is? PTSD
Yes,
is?
so anybody who experiences a trauma from any number of things has the possibility of developing PTSD. And so age isn't usually a factor. What's usually a factor is whatever a person has been exposed to. So usually they have to feel like either their life has been threatened or someone around them has been involved in serious bodily injury or lost their life. And for example, I treat a 9-year-old little girl who has PTSD because somebody in her family died very violently. I have a couple of other teenagers that I treat that their parent was killed. I have another set of individuals that I treat that one of their parents was murdered. And so those are the kinds of things that create PTSD in people who are maybe non-military based.
Yeah.
Mm-hmm.
Okay, so we see the returned soldier in our novel who's an unstable father and has a very broken life. He turns to drugs and erratic behavior. In your line of work with people who have experienced trauma, what has been the reaction to many of your patients, and how did you treat them?
So that's a really great question that you're asking. And it's not uncommon for people who have PTSD to want to get rid of their feelings and their symptoms because it's excruciatingly uncomfortable for them. So adults who have PTSD, it's not uncommon for them to drink excessive amounts of alcohol or try to find drugs or even use psychotropic drugs if they were going to use it from a mental health point of view to try to deal with those feelings. And so it's difficult for them to get a break. PTSD is very, it's not something that you can shake or compartmentalize, and so it's hard for them to sleep. It's difficult to function if it's really severe, and so it's not uncommon for them to make choices in which they can just check out or be numb for a while. Mm-hmm. It's a good question.
Sierra?
Andy refuses to get help for his PTSD. What would you encourage patients to get?
So this will be something I said a little earlier. I might be repeating myself. It is not uncommon for people who have PTSD, especially for war vets, not to trust people and not to trust or talk to people who they don't think have had similar or same experiences. So one of the things that I encourage is that folks have a support system of other people who understand what it's like, because they're more likely to talk about or to share things that they feel or experience. A lot of times, especially if it's somebody who has had who's had war experience or been exposed to things in the military, if they know that you understand military life, sometimes that's an asset to me. If I explain that I know what that is or where our family has been stationed, it goes a long way. And so I encourage patients who are in those situations. It doesn't matter if you're talking to a psychologist, you gotta talk to somebody. And so a lot of times they're more apt to trust somebody who's like them or experiences things like them.
Yeah, that makes
So
a lot
like
of
other
sense.
soldiers.
Yes.
Yeah, because in our book, Andy, he has like a lot of his army buddies come home and they're on a trip. They decide to stop by to see him, and like he has like fun for the first time in like forever, and he laughs a lot and he talks to them. But like towards the end, he snaps on them. But like just that little difference where he smiles with them for like the first time, it like really showed how much like they understood him and like how they could connect with him. Because like with them, he could talk about the war and laugh about it, and it's like not have to have like flashbacks or anything.
What you're describing is a beautiful example. Folks who have PTSD will kind of shut down and withdraw, so they don't become very social. They don't do things that other people would do. They kind of isolate themselves. And so it's a lot easier for them to not do that if they know somebody else understands. It's a beautiful example. I bet your book was great.
It was.
I actually have a question that's not on the list.
You can ask anything you like.
I come from a long line of military people,
Mm-hmm.
and none of them, from what I've heard, have never had anything to deal with any kind of trauma or anything. There was, do you think that if you're mentally strong, like, nothing, like, really bothers you, do you think that has a impact on whether you're traumatized or not?
That is a fabulous question you just asked. And so, let's say, for example, there are 5 people who all witness or exposed to the same trauma. It doesn't mean that all 5 of those people will develop PTSD, but it is possible that a couple could. And all people respond to trauma differently for lots of reasons. Sometimes it can be with how emotionally strong they are. Sometimes it can be that they've been exposed to other traumas, so they're used to it. Sometimes it can be that they're more resilient. So there's no telling who will develop PTSD, even if they've witnessed the same kinds of things. And so I think sometimes it also depends on the level of trauma, because the bigger traumas are, or the more repetitive somebody's exposed to them, the harder it is for them to overcome. So sometimes that has to do with it as well.
Yeah, that's like perfect because Andy, he has PTSD, but like before, like after he got it, like he lost his wife when Haley was at a really young age, and he also
She wasn't
lost.
his one, was she? She was like just a baby.
Yeah, so that kind of broke his heart, and then his mom died a couple years later.
Because they went to go live with her, and then she died, but they're still living in her house.
You guys are making a great point, because what we call that from a psychological point of view is a trigger. And so I'll give you another example of that same patient, that little girl that I treat who has PTSD. I had treated her for a period of time, and her symptoms had gotten better. And so she decided she didn't need to come see me, and she was doing really well. And then a trigger happened. Something triggered her, there was another trauma that occurred, and the symptoms came back. Sometimes, and in some situations, it was worse. Her nightmares got worse, her ability to sleep by herself became diminished, and so it was the trigger actually that re-traumatized or made those symptoms come back. And so again, repetitiveness or triggers are very difficult. So sometimes even if somebody's been treated for PTSD, if something else occurs, it's not uncommon for those symptoms to come back just like that.
Okay, so Dalton.
The soldier in our book has PTSD from his experiences in battle. Some of those symptoms are nightmares, flashbacks, violence, and abuse of substances. What types of symptoms of PTSD are most commonly seen? What are some famous methods to help veterans with PTSD? And what types of PTSD soldiers are common?
That's about 3 questions. I'll try to keep them straight, okay? PTSD, most common symptoms. Usually I think the thing that is the most common is nightmares. And so what you will notice is that somebody will have repetitive nightmares, sometimes several times a night, sometimes the same nightmare every night or a variation therein, and that can be re-traumatizing. So it may not be the exact same thing that they witness, that they have dreams about, but it can be something similar. And so it doesn't matter whether it's, for instance, a 9-year-old girl who experienced a homicide or a 25-year-old man who experienced a bombing. What will happen is that the nightmares of that occurrence will come into their sleep and disrupt their sleep. And so then what happens is, I don't know about you guys, but if you've ever gone without sleep, let's say you had sleepovers and you didn't go without sleep, aren't you kind of grouchy the next day? So when somebody goes many nights without being able to sleep or their sleep is disruptive, what you'll notice is that they become very irritable, that anger is common, that they get frustrated really easily, and so those are things that are pretty common no matter why somebody might have PTSD. And the most common form of treatment for PTSD, there are many, many kinds, and people in my field will argue about what's the best method. But the most common is what we refer to as exposure therapy. Now that doesn't mean we take them back out and re-traumatize them or expose them to another trauma. What it means is that in a safe place, we talk about the experiences of the trauma in small increments. So where they would feel comfortable expressing themselves or going through those things in a safe place where they're not injured or they're not hurt. So that's the most common form of treatment.
Okay.